what are the differences when you're doing little minute procedures like that? Because I know as a Black patient, when I get a scratch or
Mhm.
knife, I really get hyperpigmentation. So, how do you treat them a little bit differently when you're operating on?
Yeah, this gets into skin type, but also just any other sort of like health history, because some people have propensities with any injury to have an inflammatory condition arise at those areas as well, which is what's happening with the hyperpigmentation. It's called post-inflammatory pigment change or post-inflammatory hyperpigmentation. You can manage that. Part of the beauty of what I get to do is that the incisions, by definition, are very well hidden or invisible. So it tends to be less of an issue. But we start talking about lasers. How about that? And this is a beautiful conversation because it brings us full circle back to the first thing that I said, which is like, let's address the skin. Well, we have to think about that differently based off your skin type. I have patients, who are of Asian descent as well, like all the spectrum of what we'd call the
Yeah.
different skin types. And you have to think about treating those things differently for the exact reasons that you said. There's anatomic changes in like eyelids. We talked about eyelids.
Yeah.
And so like an Asian eyelid is different than a Caucasian eyelid. And that gets very in the maybe nuances more so of these like even baseline things, which is like, yeah, you want to treat your skin. That's the first place to go for everybody. Okay, well, you have to think about that differently in different skin types.